just after 6 a.m., the second day of the RAM event here in Oklahoma City, and we just let about the first 100 patients in the door. We did over 500 yesterday and over 830 individual services provided, so some folks got dental and vision both, and we're getting ready to have another good day.
The whole process took about an hour and 20 minutes to see 3 different people, and it took another 2 hours to get my glasses made, but I was waiting in line to get teeth pulled at the same time, and my teeth have been hurting for 6 months. I really appreciated them. Well, it was it was great. It was great. I was glad, man. This was a godsend.
Lily will pick up her glasses today. They treat children just like they were grown-ups and important. I was very impressed by that. She had 2 fillings done yesterday. She was a real trooper about that too. And the dentist was just wonderful. Everyone was very pleasant. There was no grumpiness at all, and I know they had to have been running on reserve themselves.
Well, I started working about a year ago with RAM, who's out of Knoxville, Tennessee. First thing we had to do was pass legislation to allow out-of-state healthcare providers to volunteer here. So once that was passed, RAM was very excited. We're one of a handful of states that have such a law to allow out-of-state folks to help. We had to raise some money locally. We had to find a venue here at the state fairgrounds, who've been terrifically supportive. And we had to do a lot of other things to get prepared for this day, but it's a culmination of over a year's work on the end of some of our local folks.
Normally it's hard to get local providers to work in the clinic in their hometown, but I think this one has come together, and you have a good supply of locals participating in this clinic. I see the need out there, and we see the need in the vision and the dental area more so than we do in the general medical, but the folks that here have opened their arms and received us, and it's been really great.
This actually is our 609th operation of this type during the last 25 years. They've done a superb job. You've obtained this facility here, which is very, very well suited to this kind of an event. Plenty of room for parking, and plenty of room to lay out 50, 60 dental chairs and eye exam lanes. So the work that's been done here has been just really up to par, and we're very pleased with the way it's turned out.
Oh, it's awesome. I think that the dedication of all the individuals participating is incredibly inspiring.
I'm looking forward to seeing the people, meeting the people, and be able to, let them know that we're here to be able to help. It's a big need here too. It's a lot of people that don't have health care, that don't get the general care that they need, getting the dental work, things that we might take for granted, they don't have it.
I'm taking out a lot of teeth, surgery. We have 30 chairs of surgery, 10 chairs of fillings, and 10 chairs of hygiene. When I heard about this one, I thought, I think I want to be a part of this one.
You have to love the patients because they were gracious and they had patience. At 6 o'clock, they'd been here since maybe 1 or 2 in the morning, and they were still like, thank you so much. No, thank you for sitting here and waiting on all this.
We have a lot of folks here. The demographics are immense, whether it's level of education or age. We certainly have some folks here who are very seasoned. We have others that are, spring chickens, and it's really great to have everybody work together.
We have some new graduates that are here that are learning a lot about the real world, and it's like, oh, I'm going to have a different perspective than I had just getting out of dental hygiene school.
It's definitely a good opportunity, and it's just really satisfying to be able to offer the skills that you have to help people.
It's providing a service for people who can't get it elsewhere, and kind of makes you feel good to be able to help people out, get them out of pain, and when they have no other alternatives.
To be able to give it back to the state of Oklahoma. I mean, this is where I went to school. This is where I plan to live when I'm old and gray. So why not try to take care of a state that took care of me?
There's probably more than 200 doctors and dentists and optometrists and nurses here, and then really augmented with a bunch of general volunteers and folks like myself who are just organizing this and don't have any medical training.
Volunteers, really, and never like to say it, but we have had way more than we needed here. But that's speaking highly of the local area, Oklahoma County, Oklahoma City. They had a great turnout.
Just really refreshing to see that they just didn't treat them as adults, but they got down on their level, talked to them at eye level, and talked to them and got some input back from the children also. Treated them as people.
The doctors are very good.
It's great. I mean, it's a success if you help one person who hasn't been able to have their healthcare needs met before that. We made well over 150 pairs of glasses on Friday, the first day, and we'll make hopefully over 200 today. But numbers, people like round numbers, but they're really irrelevant when you see the faces of folks and the gratitude they have for being able to get some services that they really aren't able to afford for their families, for them, for their children.
Things are sort of looking up, I think, for the many millions of people in this country that can't afford the care that they need.